Hello, good day. I'm Priscilla, and today's video is about giving a brief overview of research in nursing. So this video is the first of many videos on this platform where we will be discussing into details the various aspects of research in nursing or nursing research. So I'm a registered general nurse here in the UK. Been in the UK for the last almost 6 years. Completed my Bachelor of Science in Nursing back in Ghana. I am a critical care nurse here in the UK as well. I recently completed my 9 month research internship. I am an expert reviewer on an HRA research ethic committee. So before we begin, I really would like you to subscribe, like, share this video, and hoping to have a great session here on this platform. So before we dive into the brief overview of what research in nursing really is about, I just want to give a brief introduction of what nursing and what the research in nursing really is about. On this video, I will be using research in nursing or nursing research interchangeably. They do not mean the same thing, but there are various aspects of them that are similar. They're quite similar to each other, actually. And when we talk about the research in nursing, that's the broader field. But then when we talk about nursing research, it means applying research methodology to nursing practice or the nursing, profession, with regards to practices, education, training, and all of that. We all know that the nursing profession remains the largest profession in health and social care across the continent. Nursing has evolved over the years, and recently the RCN launched a new definition for nursing. According to their definition, nursing is a safety critical profession founded on four pillars. Among these pillars are clinical practice, education, research, and leadership. This definition was as a new definition just recently in 2023. It did talk about the fact that registered nurses use evidence based knowledge, professional and clinical judgment to assess, plan, implement, and evaluate high quality person centered nursing care. So, we for whatever we do in our nursing practice, it's based on evidence. It's based on rigorous, findings from research, and so it's very important. We do acknowledge the importance of research in nursing as we go about with our nursing practices. Research is very important. It is important because it does inform, best practice. We talked about evidence-based practice because based on the evidence, we're able to inform. The evidence informs the practices, which improve the quality of care we give to our patients. Because the concept, the theories are not based on imaginations. These are tested, tried, and tested, and the findings inform the practices, our nursing practices, to be able to give the best of care to our patients. It shapes the nursing profession. It informs policies. It contributes to the body of knowledge. When we talk about the body of knowledge, we refer to the core teachings and skills needed to work in the field of nursing. So, based on research, we're able to, you know, understand and be able to frame properly the core teachings and skills of the profession we find ourselves in. And the findings also contribute to the knowledge which shape, our everyday, activities, everyday, practices and trainings with regards to the entire profession. So there's, like I said, nursing research or research in nursing. It's a very broad, term, and we can't use one video to talk about all the aspects of research in nursing or nursing research. And so, like I said, this is an overview. We'll dive into detail some of these elements or aspects of nursing research in the videos to come. The first, on the list is identifying the research question. So, identifying the research question is very, very important. And for most of the time, I'm going to speak as a bedside nurse because I'm also a bedside nurse working in a critical care unit looking after patients. For most of us, we always faced with dilemmas. We're faced with day to day queries with regards to, or curiosity with regards to what we do. For example, working in one environment or working in one unit, you might identify or you might find yourself, rolling the patients every 2 hours per, the ward protocol or their practice. And then you go to another ward, you find, that ward or unit 10 their patients every 4 hours. You're then, you tend to ask yourself, why is this ward, turning the patient 2 hours and the other ward turning the patient 4 hourly? I mean, we all know the benefit of turning or rolling the patients, but why are others doing it 2 hourly and others doing it 4 hourly? I mean, there are more things that we do question ourselves when it comes to our clinical work. Identifying the research question is it's a whole. There is more to identifying the research question than just identifying the research question. What I mean is that there are more to it. Sometimes it does. The research question comes from reading an article. Like I said, it could come from your clinical practice. There are others where you probably have got, maybe you have an idea, an abstract idea, or probably based on what you have been observing or based on your expertise, you develop a hypothesis, which you do, wish to address by using the instrument of, research, or by using the instrument of research. So we will talk about that into details as we progress. We talked about a bit of systematic literature review. Research is a methodological process. There is a system in place with regards to identifying knowledge, testing out a therapy or whatever the research is about. And so there is a way of undertaking a literature review to be able to, you know, there's a systematic way of identifying a literature review, of which we talk about in details. We also have got research design and methodology. So these are two different terms. Design basically is a blueprint to your research study. That's the data collection, organization of the study, with regards to analyzing of the results. These are all research design, which we'll talk about. But the research methodology is about the approach to understanding research. Sorry, the approach to undertaking research, which is where we've got qualitative, quantitative. So depending on, the approach you plan to, undertake your study, you can decide to either use a quantitative or qualitative study, or even a mixed method study, where you have both the qualitative and quantitative. I mean, we all know about qualitative. If you identify a pattern, or you identify, a problem, and you want to understand the reasoning, the rationale behind that, you would definitely would want to use a qualitative study to be able to address that. When it comes to testing out a therapy, probably You have identified the benefit of incentive spirometry, and you want to test out this therapy on a section or a group of patients, or maybe patients in your unit, then obviously you would want to use a quantitative study to be able to identify the effectiveness of that therapy, which is incentive spirometry. When it comes to mixed method, maybe you do a survey or you undertake a quantitative study and then you follow it up with a qualitative by understanding the rationale for the findings of what you have identified in the quantitative study. And this is a process. Like I said, research is a process, it's a methodological process. And so there are ways we go about that. And we'll talk about that as we progress in the days to come with regards on this platform. Nursing concept and theories. So, like I said, a concept is basically an abstract idea. Maybe as a bedside nurse, you have been doing something consistently and it has been working for you, and you have developed, an idea, and you decide to develop a hypothesis based on that concept, to address it, these concepts and theories are very important because it does frame the research process to some extent. And the framework of nursing, as a science, is actually built on practice through research, mainly by analyzing and developing concepts and theories. So over the years, if you look back, most of the time, you know, people have identified concept and they followed it up with a research and have identified a finding which has been is currently applicable and which we're currently applying to our nursing practices. When we talk about theories are careful explanation of the relationship we obtain from concept which are interrelated. So you identify, and maybe you have an abstract idea. Okay, so you follow it up with a careful explanation of the relationship that you have obtained, you know, from you know the concept that you have identified, and you interrelate with, they are quite interrelated. And so there is a careful explanation of the relationship obtained, in these, concepts which are quite, related. So concept and theories are quite, they work hand in hand. And we'll talk about that as we progress. So rigor in conducting research, it refers to, critical feature of the research. It's actually a critical feature of the research process, which encompasses, the systematic approach to which we go about, research. So, like I said, it's a process. It's a systematic, comprehensive process that you can be able to undertake a study. It defines the scientific nature of whatever research we undertake, that process, and we'll talk about that as we progress. Reliability and validity. So reliability basically is the consistency of the instrument. So for example, I talked about, incentive spirometry. For example, I work in a cardiac unit, and I've read that that incentive spirometry is, helps with patients, respiratory. It prevents respiratory complication post coronary artery bypass graft. And maybe on my unit, we do not use incentive spirometry for patients, possibly prior or post, the coronary artery bypass graft surgery. And so on reading that, it's more or less like you based on the findings from whatever literature you have identified. Obviously you would have to critically appraise to make sure whether the literature you have identified is really robust, whether the study was done you know was done well, by using the critical appraisal tool, which we'll talk about that in the sessions to come. So you test the consistency of that instrument. That is reliability, and then validity is whether the instrument measure what it aims to measure. So if they're saying that, so reliability is after with that finding, if I apply that finding to my area of practice, I should be able to get not maybe not the same, but a similar you know result based on, I mean, if the inclusion and exclusion, if the inclusion criteria do matches with each other, that finding should be able to produce that result, all other things being equal. But with validity is whether the instrument measures what it aims to measure. So, I mean, you after identifying that literature, did it really measure what it was intended for? So, if it was talking about, I mean, if the aim or objective was to test out the effectiveness of incentive spirometry on these coronary artery bypass graft patient, with regards to the patient's respiratory function, either pre or post surgery. Was it really doing that at the time in the study? Was it really doing that? And if that was what the study was doing exactly, then that study becomes valid. But obviously, there are more to that, which we will talk about that as we progress. Critical appraisal, so critical appraisal, I mean, I talked about a little bit about it when we were diving a bit into the reliability and validity. So with a critical appraisal, like I said, all these things are systematic. There are processes to it. There is a tool as well for these. There are tools which are used. For example, we've got the CASP tool, which is used to appraise an article. So, appraising an article means that you have identified an article and you're using that method of measurement based on that tool, whether it's CAPS or whatever you're using, to be able to assess whether that literature or that study was done robustly, was done properly. Basically, that's what we mean by critical appraisal. And we talk about ethical review. So, ethical review, it basically means that the researcher conforms to moral principles, such that the participants' rights are protected and the research is safe for all of us. I mean, there have been instances where there've been reports about participants being exploited for studies and people being lied to and all of that. In this instance, this is more like a measure to protect the whole research process when it comes to integrity, such that the participants are protected. I mean, are they really aware of what they are getting involved in? Do they know their risks? And if there are risks, do the risks outweigh the benefit or benefit outweigh the risks? And what measures are put in place just in case there are risks? Is the consent informed? Are they really aware of what they're doing? Were they given time to, you know, be want to part of the research, or were they forced into it? So these are all some of the things we'll be talking about as we progress, further. Dissemination of results is very, very important. I mean, what's the point in doing research when you don't plan on disseminating it? Because the whole idea of research is finding the information or the result or whatever the finding is, finding these knowledge, and making use of the findings. So dissemination is important. It needs to get to the right people, the target, it needs to target the right people. It needs to get to them. That is information understandable? If they are lay people, do they really understand what the results are? And actually, the this is one of the reasons why PPRE, that's patient and public involvement in research, is very, very important, because when people are involved with research from the start, then they become more interested in the result because they feel part of the whole process. And so it makes dissemination, you know, a bit easier. When we talk about dissemination of results, we also talk about, sharing the results and presenting it in conferences, you know, you know, sh- doing a poster and, sharing it, or disseminating it to the right places, to the right people, such that people will find the findings useful and utilize it for whatever it was intended for. So, dissemination of results is very important. We will be talking about making impact with research findings. Research matter. We all know research matter. And with these, sessions, as we progress, we'll be talking a bit more about making how to make research matter by making it more impactful. We will also be, talking about ways we implementing the findings to research, involving stakeholders from the start and all of that. They are all ways of making the research findings, impactful. I mean, for example, if you are undertaking, for let's use the same incentive spirometry, probably I am a physiotherapist, who plan on undertaking this study, and maybe I don't work in the critical care unit, or maybe I do work in the critical care unit, but when it comes to maybe using the incentive spirometry, and when it comes to working in the multidisciplinary team, with regards to, caring for patients using coronary artery bypass, or even with regards to the clinical practice around coronary artery bypass graft, maybe I don't have that much knowledge about it. I may decide to involve, nurses, consultants who look after patients with these, who look after patients with this, who have completed this procedure, or patients undergoing this procedure, probably have the knowledge or the expertise, information with regards to this procedure. So involving them as stakeholders, even from the beginning, are some of the ways you disseminate and make the research impactful. Because, like I said, by involving them from the beginning, it means that you got their full attention, isn't it? These are one of the reasons why we've got things like co-production and all of that, where, the provider and the end user, the service provider and the end user, come together, for to for a certain goal, being it undertaking a study, and, using the findings to help with the therapy or the treatment that's given to these end users, that's the patient or whoever is involved in it. So it's very, very important when it comes to dissemination of results and making the research findings, impactful. When we talk about evidence-based practice, I mean, we all know about this, where we use the evidence or the findings from research to, inform our clinical work, being it a nurse or doctor, wherever. But in this case, as a nurse, we use the evidence to inform the practice. Actually, there's so much involved into this. You just don't find one information on the internet or a journal article, and decide to, push for it. There's more to that. It involves stakeholders, expert knowledge, involving people, like I said. And when you select the article or the literature, you appraise the article, making sure that the research is robust, and you just don't use one article. You've got other evidences to support it. And obviously there are a lot involved when it comes to evidence-based practice. Evidence-based practice, there's a lot to it. How to even implement evidence-based in healthcare or in nursing practice is a whole lot. We will dive into it as we move forward. Research proposal. So research proposal is a prerequisite for every researcher. Obviously, in this is the stage where the researcher, you know, justify the reason for the topic, or the you know what the researcher intend to how the researcher intend to undertake the study. So this is more or less like it's given an overview, a bit more into details, of what the researcher intend to do with whatever study they intend to undertake. So, research proposal, we will talk a bit more about that as well as we progress. And so, looking forward to the future and the things we'll be talking on this platform. And I would like to say thank you so much for watching this video. I would, please remind you, please do not forget to like, subscribe, and share this video. I'm looking forward to the next video coming shortly. Thank you.